2005, I had a triple bypass.
I was diagnosed with aortic stenosis in 2003.
I thought I was going to achieve a Boston qualifying time, and I was training for a marathon so I could get the BQ time. And I was at the Y. It was a Monday night, July 2nd, and I wound up having a heart attack.
In 2004, I found out that I had what they called a bicuspid aortic valve, which basically is a congenital heart defect. In 2007, my aortic valve got to the point where the regurgitation of the blood back into the left ventricle got so severe that the doctors recommended at that point that I needed to have the valve replaced. I've been an endurance athlete for such a long period of time, I became very nervous about what I could do after that. And it was such a big part of my life to be doing marathons and Ironman triathlons that I didn't want to lose that part of my life.
Back in 2006, I was 43 years old, very fit, healthy, had a good job, everything was going fine. And one night I had a heart attack and I got quite depressed and really struggled with depression. I needed to search to find out what I could do, and so I got on the net, and for a couple of months I searched every day. One day I typed in 2 words into Google, cardiac athlete, those 2 words, and this website came up, this forum came up, and from that moment my life changed.
I'm Laura. I was one of the original 5. My cardiac history is I was born with a congenital birth defect, one of the most common congenital birth defects, called the bicuspid aortic valve. I had surgery in 2005 initially.
My name is Mark Civic, and I'm one of the founders of this event. In 2005, at the age of 40, I went from running the Indianapolis half marathon, which is the country's largest half marathon, to the operating table at the Cleveland Clinic in about 2 weeks' time. Turns out I had an before undiagnosed aortic valve issue.
I was an athlete my whole life. I played tennis through high school, rugby in college, was a competitive power lifter for 20 years. I had to give up powerlifting because of the congenital birth defect.
And at that time was very goal-oriented with running. In terms of my goal at that point was to qualify for the Boston Marathon. So I drove the medical staff crazy when I was in the hospital because my immediate goal coming out of surgery was to run the Cleveland Clinic's half marathon, and came out, behaved myself into mono by August, just by trying to do too much.
When I did finally get the diagnosis, I couldn't powerlift anymore, and so that was pretty significant because that was 20 years of my life. So that's why I started doing other things, because aerobic activity was considered to be okay.
After I got mono, that was a disappointing thing, and next thing I know, I'm trying to find people like me, and found a website called valvereplacement.com, read about this tremendous cyclist by the name of Paul Hobbs.
Michelle, my wife, who's not here, she was trying to find support for me because I was 34 when I was diagnosed, although I was born with a heart condition, so it's a little bit of a longer story, but 34 when I was diagnosed with my aortic valve, but I forget how it was said, but it was pretty severe at the time. And she found valvereplacement.com as a way to support me, or find some support for me, because we're living in Vermont, and I was a serious bike racer at the time.
I called him up, and we started talking, comparing notes. Paul was an aortic valve patient as well. Just kept talking, and by Christmas of 2005, maybe January, February, I don't remember, Paul says, and he's not a runner, he's a cyclist, he says, why don't we all meet in Burlington and run the Burlington Marathon together? He said, do you think anybody will come? I said, come? trust it. It's sort of like Field of Dreams. Build it, they'll come.
I just gave him a call. I said, hey, you know what we should do? We should get together because Burlington has a really great relay marathon. It's a big marathon, but the relay is the way that the community gets involved locally because there's not that many marathons. There's quite a few, but it's not, like all kinds of different companies do relay marathons for the Burlington Marathon. And so I thought maybe we could get some people together, and Mark and Hugh and Laura and Christine, who is not here. Christine she had a more severe heart history than any of us, with holes in her heart and all kinds of things. They just volunteered and came up to Burlington, and we got together and had dinner in the backyard, and they all went home like the next day, and it just kind of started something that other people, like Tom and other people I was just talking to, really picked up.
We decided that it would be a great idea, since we were all so active, to get together and just share this. We had all had our surgeries within the year, and we went out to Vermont and we had a wonderful time. It was terrific, and I guess from acorns these mighty oaks have grown.
We got 5 runners for that first year. I hosted the next year in Akron. We were up to 12 runners. Laura took it the third year in New Jersey, 20 runners, and now today, look at this. We've got people here from England, from Australia. I never dreamt when I first went on to Lars' website that we'd be in the same room together, and now we're colleagues. I mean, he's a medical professional, we're the patients, but we're both pioneers.
My story starts with rugby. When I was 15, 16, I was doing very well. I wasn't very academic, and I'd managed to get into our county side as a 15-year-old, which is a bit like your state side. But on the 5th of December 1980, I knew nothing as a youngster to do with overtraining or nutrition or correct exercise prescription. I knew nothing of that at all. I just thought, like we all do, the more you play, the better you become. But no. In rugby, the more you play, the more injuries you collect, and then you shouldn't be on the pitch at all. Well, I shouldn't have been on the pitch that day because I had a pulled back muscle, and I was taking painkillers for the back muscle, and I'd been stamped on my foot, and that was wrapped up in bandages. I should not have been on that pitch, but I was, and I got caught. So I broke my neck, but luckily for me, it was temporary paralysis I had and not permanent paralysis. When I was in hospital, I had a more mature doctor say to me that really, for my own safety, I should stay in a wheelchair. Now, as a 15-year-old lad, that's the last thing you want to hear. But my own surgeon, he was an ex-rugby player himself, and he just said to me, you can do most sports, but if you play rugby again, you'll go straight to the morgue. And it woke me up. It made me realise that was it. Rugby was finished. My life was going to change. I had to think about doing something else now. But I came out of hospital and I decided I needed to build my strength back up. But not only with the strength, I was building my confidence back up as well. So I built this frame in the garden. Then from then on, I went on and did some physical education. I did a physical education qualification, but it also combined psychology and human biology, which I thought was brilliant. That's exactly what I was interested in. And then from there, I went on to do sports studies. Sports studies is a bit like sports sciences, but that was in the early days. It was called sports sciences. What do I do? Basically, I do everything. Technicians in England on the NHS have to learn to do all the different subspecialties, and we're involved in most things. Obviously, we don't do the implantation, but we're there to help the doctor with the implantation. We do the follow-ups as well. So there's a lot of independence and a lot of trust that's placed on us. But to do that, you have to be accredited, and to be accredited, you have to go on special training schemes, and you have to do exams, etc. The doctors cannot cope with the number of echoes. They couldn't physically sit there and do them themselves. We're trained to do that, and we report as well. So someone asked me, what do I do? But I'm involved in everything. I'm covered by many different professional bodies. That's me at work, sometimes smiling, sometimes not. More often than not smiling now. I'm also involved with CRY. CRY is the cardiac risk in the young. So in Italy, apparently, they screen all, I think it's 11-year-olds with an ECG and an echo and decide whether that youngster is going to be involved in school sports. And if there's an irregularity on their ECG or something, then they're sent obviously for a proper or extra screening, and that child is then treated as a cardiac patient, maybe a congenital cardiac patient. In England, there's no such thing. There's lots of people out in the sports field playing sports, and they're at risk. You people all in this room know what your risks are. I think you know your risks more than I know my risks, actually, because I've never had an angiogram. So well done. Let's remind ourselves, coronary heart disease is a big problem the whole world over. Cardiovascular disease made up 16.7 million, 29% of total global deaths in 2003. By 2010, and that's now, will be the leading cause of death in developing countries. Cardiac rehabilitation, something I missed. That's where I started out, don't forget. What's right about cardiac rehabilitation? There's been a lot of tests, randomized controlled tests, and there's a lot of evidence to show the benefit of exercise for cardiac patients. A lot of CABG patients are offered cardiac rehab and actually attend cardiac rehab, but so few PCI or angioplasty patients and stent patients and heart attack patients actually get to do cardiac rehab. So the point I'm making about this is they're left on their own. They don't know what is safe exercise. They don't know what the warning signs are when they exercise, because later on they might be motivated to go out, they buy themselves some Reebok running shoes and hit the roads on a busy day with lots of car exhaust fumes. Psychology is neglected on cardiac rehab. If you think to yourself, what I've tried to introduce onto the website, I've tried to deal with a lot of psychology as well. So the psychology is being neglected. There's inequality in provision. Very few people are actually attending. About a third of people actually attend who could possibly attend. And there's certain categories of people who miss out on cardiac rehab because the medical profession think that they're too high risk. I mean, heart failure patients are a group of people who are sometimes deliberately excluded, or a person with an ICD, because the nurses think that's an at-risk person. They're a high-risk person. I don't really want them in my class. It does go on. It does go on, and that patient could actually benefit from the cardiac rehab. So that led me to think, okay, cardiac rehab, hearts are unmonitored. With some of them, there's significant ST changes going on. Cardiac rehab benefits are proven, and it's also a good form of secondary prevention. But too few people do cardiac rehab. So the birth of an idea. I was walking along a corridor, and I passed by these two young doctors, and I heard them talking about a patient as being a cardiac cripple. Now that rang bells with me, because I'd had a doctor years ago talk to me as if I was a cripple, and that annoyed me. And it bugged me all day, and I was thinking, cardiac cripple, and I thought, well, what's the opposite to a cardiac cripple? And I thought, well, obviously it'd be a cardiac athlete, but what is a cardiac athlete? Just by changing the one word sends you in a different direction, because if you're thinking, I am a cardiac cripple now, if you heard that as a patient and you said to yourself, I'm a cardiac cripple, that's just going to send you on a downward spiral. If you think of yourself as a cardiac athlete, that's hopeful, that's positive, that's going to send you upwards. That's going to uplift you. You're going to go in an entirely different direction if you think of yourself as being a cardiac athlete than a cardiac cripple. So what is a cardiac athlete? Well, you people know what a cardiac athlete, so I'm going to skip over that. A person who's had a heart condition, made a good recovery, keen to get back to a normal life and achieving good things. You're also pioneers as well, because I was left on my own. There was no other advice. I was scared at times because I'd hear a crack in my neck and I think, oh my God, it's gone again. And I've got no one here to contact. But minute by minute, an hour goes by and you think, well, that's stupid, I'm still okay. So a lot of the time you're on your own, you haven't got people monitoring you, and you've got to be brave. And when you go out and exercise, you stick within the safe limits, you take your pulse, etc. Some days you're a bit more breathy, and you think, well, shall I call the doctor, shall I call 999? You think, no, leave it a little bit, don't leave it too long. But you know yourselves now, because you're listening and monitoring yourselves and listening to your own body. You know how your body responds to exercise, and when it's having an off day and it's not, and when it is true cardiac related. So to see how